There are two types of cohort studies, which include prospective and retrospective, which are selected based on the timing of data collection. Retrospective means to look back. It looks back in time to study events that have already occurred, whereas a prospective study, it looks forward. It looks to the future, it examines future events, follows a condition, concern, or disease into the future. So the purpose of our presentation is to focus on a prospective study. Prospective studies have been used for over a century to study determinants of disease. It is an observational study whereby no intervention is made by the researcher. Such studies provide estimates and examine associations of events in their natural settings without resorting to experimental intervention. The primary objective of this study is comparison of the frequency of disease occurrence in exposed and unexposed individuals. It is a group of individuals or cohort of subjects who are followed over a long period of time in order to determine either the incidence rate of certain diseases or the risk factors that lead to those diseases. It is characterized by the selection of the cohort and measurement of risk factors or variables before the outcome has occurred, thereby establishing a time span necessary for determining causality. An important thing to remember is that the outcome of interest should be common, otherwise the number of outcomes observed will be too small to be statistically meaningful. Research is guided by a deductive approach, whereby the goal of the researcher is to test concepts and patterns known from theory. Deduction begins with a universal view on a situation and works back to the specifics. It is theory testing research that moves towards hypothesis testing, which is conducted in order to identify the extent and nature of cause and effect relationships. Epistemological perspective is based on a positivist paradigm. The basic beliefs of this paradigm is that the world is external and objective. The observer is independent and science is value-free. The researcher should focus on facts, uncover causality between variables, and formulate and test hypotheses, which is a deductive approach. Methods include operationalizing concepts so that they can be measured, using large samples from which to generalize to the population, and quantitative methods. Now I will discuss sampling. Some steps in sampling include identifying accessible population and then decide how best to characterize the target population. Each subject must have the potential to develop the outcome of interest. Next, specify the eligibility criteria, for example, age, sex. Also, this is a good time to exclude potential participants, such as individuals with poor health. Next, specify the sampling plan. This would include probability sampling and power analysis. Lastly, consider the following factors when recruiting the sample, such as your recruitment method: courtesy, persistence, incentives, benefits, sharing results, convenience, endorsements, and assurances. Some points on probability sampling. All units of the target population have a non-zero probability to take part in the study. At some point, the sampling process involves random selection. The main type of probability sampling used in a prospective study is stratified sampling, whereby the target population is first divided into separate strata and samples are selected within each stratum, either through simple or systematic sampling. It is also important to remember that you should have a solid sampling plan because of the great heterogeneity usually observed in the target population. Thus, this heterogeneity has to be also reflected in the sample. In data collection, I will discuss survey research. The terms questionnaire and survey are often used interchangeably. However, surveys are an overall research design, whereas questionnaires are one of the research methods used within surveys. Surveys are used to study large groups or populations by using a standardized quantitative approach to identify beliefs, attitudes, behavior, and other characteristics. Surveys obtain information from people through self-report, whereby participants respond to a series of questions. Now, there are benefits and disadvantages of survey research. The benefits are flexibility and broad scope, They can be applied to many populations and can focus on a wide range of topics. Information collected can be used for many purposes. Some of the disadvantages include responses tend to be relatively superficial and they rarely probe into human complexities. Survey data can be collected in a number of ways. These include personal interviews, telephone interviews, and questionnaires. Questionnaires are self-administered. Respondents read the questions and give their answers in writing. Because respondents differ in their reading levels and their ability to communicate in writing, caution must be taken as to word questions clearly and simply. Although they are economical, they are not always appropriate for surveying certain populations, for example, children. Response rates to questionnaires have dropped dramatically over the past several years, so therefore more efficient methods for recruitment, data collection, and follow-up are essential. And some of these methods include web-based e-consent, using commercial providers of marketing data, smartphones, apps, email, social media, and the internet. Analysis of data collected is determined by the research question to be answered, the consideration of the nature of the outcome or measure of disease occurrence, the nature of the exposures and covariates of concern and their relations with the outcome. Data can be analyzed with descriptive and/or inferential statistics. Descriptive statistics describes the data using frequency tables and percentages, which can include the mode, median, mean, standard deviation, and interquartile range. It is most often used to summarize sample characteristics. It describes key research variables. It documents methodological features, for example, the response rate. Things to remember about descriptive statistics is that they are seldom used to answer a research question. Readers of reports cannot draw inferences about the study's external validity without understanding who the participants were, especially with regard to key demographic characteristics and health-related attributes. Inferential statistics gives us an idea of the relationships between variables that exist in our sample and whether these might be expected to hold true in the greater population from which the sample was drawn. Hypotheses can be tested. If we have a null hypothesis, this means there is no difference between variables and the results are said to accept or reject the null hypothesis. It also offers a framework for deciding whether the sampling error from sampling variations is too high to provide reliable population estimates. And different researchers applying inferential statistics to the same data are likely to draw the same conclusions. Prospective cohort designs have been used for over a century to study determinants of disease. They are invaluable in epidemiology and have been used to study a broad range of exposures, such as infections, nutritional, occupational, and lifestyle factors. They are used for many reasons in healthcare research, such information being central to medical practice and public health, and really just fundamental interest to the general population. Prospective design is implemented when the researcher wants to study the natural history of a disease, causes, and prognosis in order to determine whether there is an effect on an individual's health. Also, prospective studies analyzes predictors or risk factors, thereby enabling calculation of relative risk. And lastly, many variables that technically could be manipulated cannot be manipulated ethically, and most human characteristics cannot be experimentally manipulated. Therefore, the obvious choice is a non-experimental study to explore causal relationships when experimental work is not possible. Some possible research questions in a prospective study include: is the incidence of outcome events associated with former presence or absence of exposure? Is there a causal relationship between variables being measured? And is there any other way to explain the available evidence? A disadvantage to a prospective cohort study is the sample selected at the beginning of the study may not be appropriate for later purposes. The scale of loss of the sample members may be too great, thus you have consequential deterioration of the representation. One of the major disadvantages is referred to as loss to follow-up. This is when you lose contact with the participants over time. This happens more often when there is a long follow-up period. This type of study can also have missing data, not just with having individuals in the study be missing or deceased, but by having individuals in the study not completing or answering the questions. Each individual in the study also has the right to refuse to be in the study at any time. This also affects the outcome of the data analyzed. False positive tests are often viewed to have the confounding variables as a principal contributor. And this type of study can be expensive to carry out as it takes a long time and requires large numbers. A major advantage of the prospective cohort study is that it follows patients for an extended period of time into the future. This makes it possible to assert that the exposure took place before the outcome. It also may uncover unanticipated associations with the outcome. And following the patient into the future also makes it possible to minimize recall bias, since the information on the exposure and the outcome will be collected in real time. And also this type of study allows the researcher to study natural history of disease, causes, and prognosis. And it can address research questions without experimental design, which is important for ethical reasons, as you cannot always manipulate independent variables or human characteristics. Prospective cohort studies are not seen as conclusive evidence. They will allow the researcher to see that the individual's exposures were before the diagnosis. However, this does not mean that the exposure caused the disease. Selection bias and confounding factors are vulnerabilities that these studies have. Therefore, the researcher must ensure the consistency of the baseline characteristics of the groups, and this does affect the internal validity of the study. Choosing the participants are not completely randomized. Therefore, prospective cohort studies are susceptible to both known and unknown confounding factors. A thorough literature review will help the researcher identify the known confounding variables in the study. There's also some common tests that assess different confounding variables, which are the chi-square test or the t-test. And these tests are sensitive to sample size. And lastly, there are analytical strategies that are used to assess results. This will aid the researcher in looking at the relationship between variables, both the independent and dependent. One type of analytical strategy is regression analysis. Another is known as stratification. Also, a researcher must pay attention to sensitivity analysis. This allows an individual to verify the extent ethical research principles to consider integrated into the study design. Seeks to do good or to benefit participants. So research should benefit individual participants and society as a whole. Non-maleficence means to do no harm. Researchers do have a responsibility to safeguard participants. Therefore, there should be no excessive physical, emotional, or psychological demands. If any distress does occur throughout the study, mechanisms of support should be in place. Individual rights or autonomy. Included in this is informed consent. So informed consent means that participants have adequate information regarding the research and have the power of free choice, enabling them to consent to or decline participation voluntarily. And this can happen any point during the research study. Justice includes the researcher being obliged to treat participants fairly and equitably throughout the research study. Therefore, certain individuals, groups, or communities should not be excluded from the potential benefits of the participation. Veracity involves the responsibility of the researcher to tell the truth about the study and the act of deception. And lastly, we have fidelity. Fidelity is when the researchers ensures confidentiality to the participants. Other ethical considerations include code of ethics. So a researcher must abide by their own code of ethics, such as professional ethics, medical ethics. Another example would be International Council of Nurses Code. A researcher must also abide by the federal, provincial, state laws. This can include statutory laws, common laws, professional code of ethics, law of privacy, Animal Protection Act, and fundamental rights of every citizen protected by the Constitution. And lastly, for cohort studies, it's important to consider today one of the requirements sometimes for these studies are biological specimens for genetic analysis. Therefore, consent must be given for future use of such specimens for research purposes. So ethically, does the researcher have to share results regarding genetic information? In reviewing the literature, there really was no definitive answer to this question.